When caring for clients with psychiatric diagnoses, the nurse recalls that the purpose of psychiatric diagnoses or psychiatric labeling is to: Option A. Identify those individuals in need of more specialized care. Option B. Identify those individuals who are at risk for harming others. Option C. Enable the client's treatment team to plan appropriate and comprehensive care. Option D. Define the nursing care for individuals with similar diagnoses. The correct answer is: enable the client's treatment team to plan appropriate and comprehensive care. A patient with a history of schizophrenia is admitted to the acute psychiatric care unit. He mutters to himself as the nurse attempts to take a history and yells, "I don't want to answer any more questions. There are too many voices in this room." Which of the following assessment questions should the nurse ask next? Option A. Are the voices telling you to do things? Option B. Do you feel as though you want to harm yourself or anyone else? Option C. Who else is talking in this room? It's just you and me. Option D. I don't hear any other voices. The correct answer is: are the voices telling you to do things? After 2 weeks of receiving lithium therapy, a patient in the psychiatric unit becomes depressed. Which of the following evaluations of the patient's behavior by the nurse would be most accurate? Option A. The treatment plan is not effective. The patient requires a larger dose of lithium. Option B. This is a normal response to lithium therapy. The patient should continue with the current treatment plan. Option C. This is a normal response to lithium therapy. The patient should be monitored for suicidal behavior. Option D. The treatment plan is not effective. The patient requires an antidepressant. The correct answer is: this is a normal response to lithium therapy. The patient should be monitored for suicidal behavior. The client is having electroconvulsive therapy for treatment of severe depression. Prior to the ECT, the nurse should: Option A. Apply a tourniquet to the client's arm. Option B. Administer an anticonvulsant medication. Option C. Ask the client if he is allergic to shellfish. Option D. Apply a blood pressure cuff to the arm. The correct answer is: apply a blood pressure cuff to the arm. A client on the psychiatric unit is in an uncontrolled rage and is threatening other clients and staff. What is the most appropriate action for the nurse to take? Option A. Call security for assistance and prepare to sedate the client. Option B. Tell the client to calm down and ask him if he would like to play cards. Option C. Tell the client that if he continues his behavior, he will be punished. Option D. Leave the client alone until he calms down. The correct answer is call security for assistance and prepare to sedate the client. The nurse is interviewing a newly admitted psychiatric client. Which nursing statement is an example of offering a general lead? Option A. Do you know why you are here? Option B. Are you feeling depressed or anxious? Option C. Yes, I see. Go on. Option D. Can you chronologically order the events that led to your admission? The correct answer is yes, I see. Go on. You were a new nurse in a geriatric ward. The son of one of your patients discussed that he has noticed his mother is not being treated well in the ward, and that she looks very dehydrated and malnourished. How do you deal with the scenario? Option A. Do not do anything, because it is not much of a concern. Option B. Discuss the case with a colleague. Option C. Report this to your supervisor. Option D. Make a decision not to intervene, it will be dealt with by management. The correct answer is report this to your supervisor. The client is having electroconvulsive therapy for treatment of severe depression. Prior to the ECT, the nurse should. Option A. Apply a tourniquet to the client's arm. Option B. Administer an anticonvulsant medication. Option C. Ask the client if he is allergic to shellfish. Option D. Apply a blood pressure cuff to the arm. The correct answer is apply a blood pressure cuff to the arm. A client is brought to the emergency room by the police. He is combative and yells, "I have to get out of here. They are trying to kill me." Which assessment is most likely correct in relation to this statement? Option A. The client is experiencing an auditory hallucination. Option B. The client is having a delusion of grandeur. Option C. The client is experiencing paranoid delusions. Option D. The client is intoxicated. The correct answer is the client is experiencing paranoid delusions. A home care nurse performs a home safety assessment and discovers that a client is using a space heater to heat their apartment. Which of the following instructions would the nurse provide to the client regarding the use of the space heater? Option A. A space heater should not be used in an apartment. Option B. Space heater to be placed at least 3 feet from anything that can burn. Option C. The space heater should be placed in the hallway at night. Option D. The space heater should be kept at a low setting at all times. The correct answer is space heater to be placed at least 3 feet from anything that can burn. The nurse cares for an elderly patient with moderate hearing loss. The nurse should teach the patient's family to use which of the following approaches when speaking to the patient? Option A. Raise your voice until the patient is able to hear you. Option B. Face the patient and speak quickly using a high voice. Option C. Face the patient and speak slowly using a slightly lowered voice. Option D. Use facial expressions and speak as you would formally. The correct answer is face the patient and speak slowly using a slightly lowered voice. An elderly client with an abdominal surgery is admitted to the unit following surgery. In anticipation of complications of anesthesia and narcotic administration, the nurse should. Option A. Administer oxygen via nasal cannula. Option B. Have naloxone available. Option C. Prepare to administer blood products. Option D. Prepare to do cardio resuscitation. The correct answer is have naloxone available. The client with Alzheimer's disease is being assisted with activities of daily living when the nurse notes that the client uses her toothbrush to brush her hair. The nurse is aware that the client is exhibiting. Option A. Agnosia. Option B. Apraxia. Option C. Anomia. Option D. Aphasia. The correct answer is apraxia. The client with dementia is experiencing confusion late in the afternoon and before bedtime. The nurse is aware that the client is experiencing what is known as Option A. Chronic fatigue syndrome. Option B. Normal aging. Option C. Sundowning. Option D. Delusions. The correct answer is sundowning. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to Option A. Lack of exercise. Option B. Hormonal disturbances. Option C. Lack of calcium. Option D. Genetic predisposition. The correct answer is hormonal disturbances. A client with Alzheimer's disease is awaiting placement in a skilled nursing facility. Which long-term plans would be most therapeutic for the client? Option A. Placing mirrors in several locations in the home. Option B. Placing a picture of herself in her bedroom. Option C. Placing simple signs to indicate the location of the bedroom, bathroom, and so on. Option D. Alternating healthcare workers to prevent boredom. The correct answer is placing simple signs to indicate the location of the bedroom, bathroom, and so on. An 86-year-old male with senile dementia has been physically abused and neglected for the past 2 years by his live-in caregiver. He has since moved and is living with his son and daughter-in-law. Which response by the client's son would cause the nurse great concern? Option A. How can we obtain reliable help to assist us in taking care of Dad? We can't do it alone. Option B. Dad used to beat us kids all the time. I wonder if he remembered that when it happened to him. Option C. I'm not sure how to deal with Dad's constant repetition of words. Option D. I plan to ask my sister and brother to help my wife and me with Dad on the weekends. The correct answer is Dad used to beat us kids all the time. I wonder if he remembered that when it happened to him. Fiona, 70 years old, has recently been diagnosed with type 2 diabetes. You have devised a care plan to meet her nutritional needs. However, you have noted that she has poorly fitting dentures. Which of the following is the least likely risk to the service user? Option A. Malnutrition. Option B. Hyperglycemia. Option C. Dehydration. Option D. Hypoglycemia. The correct answer is hyperglycemia. A client with Alzheimer's disease is awaiting placement in a skilled nursing facility. Which long-term plans would be most therapeutic for the client? Option A. Placing mirrors in several locations in the home. Option B. Placing a picture of herself in her bedroom. Option C. Placing simple signs to indicate the location of the bedroom, bathroom, and so on. Option D. Alternating healthcare workers to prevent boredom. The correct answer is placing simple signs to indicate the location of the bedroom, bathroom, and so on. Nurses who seek to enhance their cultural competency skills and apply sensitivity toward others are committed to which professional nursing value? Option A. Autonomy. Option B. Strong commitment to service. Option C. Belief in the dignity and worth of each person. Option D. Commitment to education. The correct answer is belief in the dignity and worth of each person.